Leader of the third party.
Thank you, Honourable Speaker. And we know that the COVID-19 pandemic is affecting people in many ways, and we are also at this moment in an overwhelming and worsening mental health crisis that's been called a shadow pandemic. The overdose emergency is continuing at a horrifying rate. Domestic violence rates are up, and people are more isolated, more anxious, and more depressed than ever. And we are now headed into the highest risk season of the year. And we know that our public healthcare system, as currently configured, despite the best intentions, cannot adequately respond to this crisis. My question for you, Honourable Speaker, is to the Minister of Mental Health and Addictions. Before the snap election was called, the former minister committed to working with the BC Psychological Association on a pilot project that would better integrate psychologists into primary care, allowing them to work alongside their medical colleagues to provide much-needed mental health care to all British Columbians, regardless of income. Will the new minister confirm that the reforms needed to allow psychologists to become eligible providers through the government-funded billing system will go forward province-wide?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker, and thank you to the member for the continued advocacy in this area. I share the member's concerns about the double impact of the pandemic and exacerbating an already alarming mental health system. Anybody who's watching, anybody who has a family who is feeling isolated or anxious, please reach out. Since yesterday's questions in the House, I have been able to confirm through my colleagues in within the mental health support system that the online supports that we built up since the pandemic started have capacity. We've got, if you phone 811, if you go to bc.gov.ca/COVID, there are links to online mental health supports so you can stay safe at home, still have that access to the counseling that we need. I'm encouraged by the direct invitation in the mandate letter that the Premier gave me to expand access to mental health supports and to use all tools. So I welcome the conversation with the Green Party. The tool that they mentioned is certainly one of the ones that we can talk about. We need all the best ideas to be able to bring relief to families. And maybe I'll just finish, Mr. Speaker, by saying going into the Christmas holiday and into the holiday season and solstice where the hours are the shortest, just urge all of us to reach out, especially to friends, those who are isolated. It's going to be a difficult time the next month ahead, and all support, all the support that we can give as individuals for our communities is going to make a difference.
Leader of the third party on her first supplemental.
Thank you, Honourable Speaker. And just to be clear, this is not a tool of the BC Green Caucus. This is a tool of the BC Psychological Association that had been working with government before the snap election and had been creating a pathway to ensure that all British Columbians could have access to mental health care through the provincial billing system. And so I'm going to hope that the Minister can respond to that, as well as the BC Psychological First Aid call line that used to be in place as a result of the earliest stage of the pandemic had registered psychologists volunteering to support British Columbians with mental health issues free of charge. It was closed in July. And so my additional question, in addition to the first question, which I'm hoping I can still get an answer to, Honourable Speaker, is will the Minister also commit not only to working with the BC Psychologists Association to provide mental health care to all British Columbians, but to ensure that this psychological first aid line can reopen immediately and provide evidence-based psychological care to anybody who needs it, particularly as we go into this most stressful time of the year?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. People are hurting, and although we've made progress pulling together a mental health and overdose system together, having inherited in 2017 not much of a system at all. We've got a long way to go. So I'll say again to the member, the Premier asks me specifically in my mandate letter to continue to build a comprehensive system of mental health and addiction support, especially to support people through COVID-19. Invites me specifically to expand access to counseling using new e-health and other virtual technologies. I've confirmed that that system, were people to need help today, tomorrow, in the weeks ahead, both our 811 line and the government COVID site are the best way to access that. And I'd be very happy to return to the member with an update on the specific consultation that was happening back in September. We need all tools applied to the crisis at hand. All options are on the table, and I look forward to picking up that work again to carry on the work of my predecessor, Judy Darcy.